Namaskar and a very warm welcome to this edition of our program Let's Talk Health Oncology Queries. I'm Nidhi Kumar and you're watching India Science. And India's cumulative COVID-19 vaccination coverage exceeds 175 crores. India reported 16,051 new COVID cases, more than 7 lakh vaccine doses administered in the last 24 hours, and the recovery rate is currently at 98.33%. Well, as COVID-19 continues to worry us across the world, COVID-related queries are on the go. People are speculating about the booster doses and its effects as well. In this program, we take your questions from Facebook and YouTube Live, and today we are joined by the very well-known Dr. Sunil Kumar, Additional Professor Surgical Oncology at the All India Institute of Medical Sciences, New Delhi. Many thanks for joining us today, sir, and namaste. I would like an overview first from you. Please tell our viewers about the current cancer scenario in India in view of the Omicron COVID-19 cases, the new strains, and how do you prioritize cancer management in such times? Is there any specific protocol?
Thanks for the question. So, first part was that the cancer scenario in India. Let's talk about how many cases we see every year, as well as if you take at a particular time, so how many cases we expect to be in the country. As per WHO estimate and also from our registry data, roughly around 18 to 20 lakhs number, that's the number of cancer cases.
What I am talking about, the new cancer cases, they are reported every year in India. And that is the new cases, if you take what we call incidence. But when you talk about the number of cases
at any given time, that will be roughly to the tune of around 20 to 25 lakhs any day. That includes both new as well as old cases. Uh, as far as cancer is concerned in India, now it is fast catching up as a significant cause of mortality because of the diseases. 5 years back, it was among the, first 10 or so, and now it is within first five. To be honest, within next 5 years, it will become probably number two or number one cause of cancer, disease-related death in India. So the volume itself is so huge, and that's mind-boggling. Here comes the scenario when you talk about the viewpoint from COVID-19 related. Now, when COVID-19 came 2 years back, obviously the public health priorities were replaced, and diseases like cancer, which were always an emergency or priority for treatment and management, they were also going side by side. But obviously, because of the healthcare priorities and lockdown, lot of patients did suffer because they could not avail their treatment on time, either because of logistics or because of the non-availability or closure of the facility which were providing routine services. One flip side of COVID-19 is that a lot of cases, particularly related to respiratory tract, like lung cancer also, they came into light when they were being investigated from COVID-19 point of view. So yes, there was a bad side of COVID-19 effect on cancer management, but at the same time, we came to know about a number of new cases which were hiding, or probably they would have come out into light later on with maybe advanced stage. So some early stage cancer cases were also detected, but that's a small part of that. Now coming to the protocol of management as far as COVID-19 and cancer in parallel is concerned. Yes, cancer is an emergency and always takes a priority as far as immediate administration of treatment is concerned. But at the same time, redeployment of the services, both in terms of the healthcare facilities and manpower, it becomes quite challenging to continue with the cancer care in the COVID-19 scenario. Reason being, one example I'll give you is that our National Cancer Institute in Chhattisgarh, which is 700 bedded facility anticipated, and which was giving full-fledged cancer service, was converted into a COVID-19 dedicated hospital. So essentially, all the cancer care there suffered heavily and was stopped for quite some time till the time COVID-19 facilities was kind of rolled back. So this is just one example, and you can find so many in government facilities because the priority of healthcare staff as well as services towards the COVID, the chronic diseases have suffered quite a lot, and cancer being the foremost among them is not an exception either.
Yes, sir. Doctor, what are the common cancers that one would see in India and in males and females? If you could give us a broad idea of the same.
Yes, obviously, because the nature of the biology as well as the organ distribution is different in males and females. So the prevalence of cancer is also going to reflect that fact. So if you take in males, the first five most common cancers would be first oral cancer or oral cavity cancer, then you can have lung cancer, and then some GI cancer like esophageal or food pipe cancer, then you have gallbladder cancer, apart from that, stomach cancer. Some other cancers are also common, but these are the most common ones. The prostate cancer, which was also very common, thankfully is not a very high cause of mortality, but incidence wise, that is definitely one of the common cancers. Similarly, some of the cancers which are coming up rapidly now are like colorectal cancer, or say for example even the blood cancer part, which are although rare, not that common, but the incidence is increasing. If you talk about females, the two most common cancer which will constitute roughly around half of the total number of cancer cases in females will be breast cancer and cervical cancer or uterine cancer, if you combine these two, cervical and uterine. So apart from that, some other cancers which are common in males, they are also common in females, like lung cancer, oral cancer, and also some gastrointestinal cancer like gallbladder cancer, which is the most common GI cancer in females. Apart from that, you have increasing incidence of gastric cancer as well as esophageal cancer. Rest of the cancers are more or less same as compared to males and females, but there is a marked difference between the first two cancers in males and females.
Right, doctor. Can you throw some light on cancer screening and early detection? How do you screen it?
Yeah, so let's understand what is the very meaning of the word screening. By that you mean that you are looking for a disease or something which is not apparently visible in a healthy looking person. It might be developing at a very early stage, or it might be hiding without any symptoms, but slowly it keeps growing, and after a certain time it will manifest with certain symptoms, but by that time it becomes quite late. So that's the reason you want to catch the disease in a very early stage. And cancer is a disease which is has got a continuous progression from very early stage disease like less than stage 1 to stage 1 to stage 4, where the entire body is kind of infested by the tumor cells. So by cancer screening, you want to find out the very early stage of the disease, which has just started developing and can be found out only by certain specific method, either by clinical examination or by certain investigations, because you don't have symptom, you are looking apparently healthy, but you are having the disease, it's just hiding inside you, and we are trying to figure out that how we can find the whether you are developing that disease, and if at all, at what stage and where exactly it is developing. So that's the cancer screening part. It is prevalent in quite and this is very common in Western countries, but as far as India is concerned, we do not have any well organized at a national level any cancer screening program, and that's the reason why we see the number of advanced cases, which is far more higher in number compared to any Western world, because they find the disease at very early stage, because the screening programs are continuous and everybody is more or less enrolled in that. But we do not have those programs, and by the time patients come with their symptoms, the disease has become quite advanced, and it becomes many a times untreatable also. So that's the value of cancer screening, that you can find out the disease very early, treat it very with minimal kind of methodology, and even the result will be very much superior compared to treating in an advanced stage. Common cancers for which the screening is available as well as being utilized world over is, I'll give example of breast cancer in females, which is a very common and kind of a very effective way of finding the disease at very early stage, and then you can start the treatment right there. Similarly, colorectal cancer, that is also a screen detected cancer in many part of the world, particularly the western as well as the developed part of the world. But in India, as far as screening is concerned, since there are limitations of logistics as well as we do not have a national organized program, but we are in a process, or we are thinking, or we are trying to do it on a pilot basis, particularly for few cancers. Example where it can be even done by a ground level healthcare worker. I'll give example of oral cancer. Same, for example, cervical cancer, also the breast cancer. So these are the some of the cancer which can be easily detected either by visual inspection or palpation, and they are the priority as far as the prevalence of cancer in India is concerned, because these are highly prevalent cancer. And if you try to strike them with the help of screening, the yield is going to be very high, and it's very going to be rewarding.
Right, doctor. Another question that comes to my mind is that what are the common myths that we see about patients in cancer and investigations and treatment? And what are the first steps of investigation that you would follow for, say, stomach cancer or cancer for the prostate specifically?
Okay, let's take it one by one, because these two are different questions. First question, you asked me about what are the common myths which are prevalent about the cancer. I'm glad that you asked this question, because of the lack of awareness, not only on the part of the general population or the public, but also on the part of physician and healthcare workers as well. What happens is that there are so many myths about cancers that many a times patient get confused, as well as they are not able to reach the point of treatment as early as possible, and the whole treatment gets delayed. Common myths I like to elicit: number one is that cancer is incurable. That's not true. In fact, what is important is that how early your disease has been diagnosed. It all depends on that. So if your disease has been diagnosed at early stage, there is very high chance that you will be cured of the disease. That is, it's not going to come back ever in your life. But that's not true for advanced disease. That's the whole difference. Second common myth is that operation, or the moment you try to do surgery for cancer, it will get spread, which is absolutely incorrect, because surgery happens to be actually the most common methodology of curing cancer. And that's a complete myth that if you do surgery, then the cancer will spread. Similarly, you will come to know by many people, they have assumption that once you have cancer or so, or your previous generation in your father, your uncle was having, someone was having cancer, you will also have it. That's not true. It's not a disease which runs from generation to generation. Although there are some cancers which have got genetic predilection, but that doesn't mean that all the cancers will be coming from one generation to other generation. And if you have the cancer, then your child will also have it, or your relatives will also have it. If you go to rural areas, particularly, the myth is that it's a kind of disease which can be transmitted from one person to other. That's again completely untrue, completely wrong. And why I'm saying about this is that the behavior or the kind of attitude of the society towards the cancer patient, it becomes totally different there in rural areas think that if you are coming in contact with a cancer patient, you can catch the disease. And many a times, such patients are actually socially boycotted, which is quite unfortunate. We come to know about these incidents very commonly in our clinic, and that is just because people do not have correct knowledge about that, about the nature of disease, as well as how it is transmitted, how it is developed, and how it is handled. Another example of the myth is that the cancer treatment is very, very costly and it cannot be done in B or medium class cities, which is again not true. That for they think that for every cancer you have to run to metropolitan cities like Delhi or Mumbai or so. That's not true. Nowadays we have the cancer facilities which are quite spread out, also very much available in even smaller cities, and the public has now opportunity to avail those facilities right at the beginning rather than wasting time running from here and there. There are the huge number of myths there, but obviously I will not, for the time being, right now go into detail of each other. I will come to the second part of your question that if I'm correct, you asked me that how the gastric cancer and prostate cancer is diagnosed. Am I right?
Yes, sir.
Okay. So let's take one by one. If you talk about gastric cancer, obviously every cancer has got some different symptom. If you talk about gastric cancer, commonly the patient will have either early satiety, what we call fullness sensation, that even you eaten quite small amount of food and you feel very much full about that. Then you have similarly reflux symptom, what we call is that sour irritation, or you have sour fluid coming in your mouth, that is the reflux symptom. Many a times you are also having black color in your stool because you are losing blood through the GI system, and then your stool becomes blackened. If you have any obstruction of the food pipe because of the gastric cancer, then you can have multiple episodes of vomiting, which will contain undigested food. You can also have blood in your vomiting, many a times what we call hematemesis, and that is one of the very, very alarming symptom for gastric cancer. These are about the symptoms which are when you have localized kind of cancer, but when you have advanced gastric cancer, you will have very much weight loss, total loss of appetite, and you will get emaciated. Many a times you are so pale or anemic that you are feeling very weak, lethargic, as well as tired. Now let's come to prostate cancer. Since prostate is part of our urinary system, so symptoms are related essentially to the urinary tract. So what happens is that you have essentially obstruction in urine flow. So you may find it that you have to get up many times in the night to pass urine because you are not able to evacuate it completely in one go. You have to apply much force to pass urine, and many a times the passage becomes so narrow that you are just running to washroom many a times and you are not able to evacuate yourself. Also, you can have blood in your urine, and sometimes the irritable symptoms, or what we call that, if the symptoms are advanced, then you may have total obstruction of the urine or urinary retention as well. So these
All
are the symptoms of prostatic cancer. But more important is that even if small one or two symptoms are there, one should not neglect them.
Doctor, what is hormone therapy for cancer? Also tell us about photodynamic therapy and immunotherapy.
Okay, so you asked me about the three different modalities of treatment for cancer which are being used for treatment. Let's talk about the photodynamic therapy. So, photodynamic therapy is essentially used for cancers where a specific light is thrown, or the it it is thrown on the tumor area with a specific wavelength so that it destroys the tumor cells. Along with that, we also inject certain drugs which are very much light sensitive. And once you throw the light or apply the light through a very, very special kind of equipment, what happens is that it will start killing the cells. Particularly, that is used for food pipe cancers also, where you have complete obstruction. Apart from that, we also have these treatments for jaundice as well and certain other cancer. Now, coming to the immunotherapy, which is far more common modality of treatment compared to photodynamic also. And that again has got very, very diverse and versatile kind of use. It's the upcoming modality of treatment in cancer. And it's not very old. What happens is that in immunotherapy is that essentially you are priming your regular immune cells, which are part of your natural immune system, to fight with the cancer cells. Cancer cells, they are very smart, and many times they fool the immune cells like the white blood cells, which we normally call B cells and T cells. So what happens is that when you apply the immunotherapy, this whole pathway gets activated so that your natural immune system that gets a capability to recognize the tumor cells or cancer cells as foreign body and starts attacking them or starts fighting with them. So that's a common way of elimination of cancer cells, and it is very much being used nowadays, particularly in lung cancer, gastric cancer, ovarian cancer, even breast cancer, or food pipe cancer. There are a number of uses for this, but slowly as the research is progressing, the immunotherapy is coming into more and more into uses. The problem part of the immune therapy is that because the drugs are costly and they are not easily available, particularly in the developing world, the cost is a huge issue because these molecules are patented as well as just the recent one, and they happen to be very costly. Now, coming to the third part of the treatment, what you asked, that is targeted therapy. So targeted therapy, as the name suggests, that target, you identify the target and then you try to block that or attack that target where the cancer cells are using that to proliferate themselves. So a number of drugs are there, and they are dictated by if there is a receptor available for these targeted. Not everybody can be suitable for targeted therapy. So certain drugs are there which will attack the receptors which are specific for particular kind of cancer, and within those cancers they can be either receptor will be active or not. If it is active, it can be blocked with the help of targeted therapy, and that can be a kind of modality for treatment. One simple example is trastuzumab. So target therapy, also you can say that receptor blockage like estrogen and progesterone receptor blockage. So these are all under the domain of targeted therapy. A number of drugs are there which will be used, and this is how the cancer treatment is done.
Absolutely, doctor. Question now coming to us, flashing on my screen, is at what age should I start regular mammograms? Could you please answer this? This is from a 26-year-old lady.
Okay, thanks, ma'am. So it's important that there are two aspects of screening through mammogram or checkup for early detection. One is that those patients or those ladies where there is a significant family history in the which is present. By that I mean that your first degree relative, either your mother, your masizi, or your sisters, they had they had breast cancer, and if you happen to be related to them in a first degree way, so for them the early screening should be started. But in general, what we recommend is that after the age of 45, at least once in a 2 year mammogram should be done to detect the breast cancer. Once you reach the age of 55 or so, it should be done on yearly basis.
Right, doctor. Could you also now specify and tell us the factors which affect giving of chemotherapy to patients? What is chemotherapy and how is it given?
Yes. So again, that's a very valid and common question, that what is chemotherapy? Essentially, they are nothing but drugs which are used specifically to kill the cancer cells. As you know, cancer cells have a tendency to divide very rapidly. And this is what we exploit when we do the treatment through chemotherapy. So, chemotherapies are essentially either injectable or oral drugs which are specifically designed for cancer patients to kill the cancer cells. They are not given on regular basis, but they are essentially most of the time they are designed in a cyclic fashion. That is, once you have taken the chemotherapy, the next cycle will be either 2 weeks or 3 weeks, or even maybe even after a week or so. So that by that time, your irregular immune system, your cells or your blood system has opportunity to recover from, because what happens after chemotherapy is that it acts on your bone marrow also, which is a site for blood production. So there are a number of side effects of chemotherapy, simply because along with the cancer cells, it will also kill the normal cells, normal dividing cells. And most common is the side effects are either you have severe nausea, vomiting, but also you have suppression of your blood level, your blood counts are down, and sometimes your blood counts are so low then you get infections as well, like bacterial pneumonia or even fungal infection. So chemotherapy drugs are used for cancer patients in a specific way and in a specific dose, only to kill the cancer cells.
Right, doctor. We have another question from a viewer who's asking that he's going to start radiation sometime next week. What should he expect and what can he do to decrease the fatigue?
Yes, radiation therapy is one of the kind of a pillars of uh, cancer treatment, apart from surgery and chemotherapy, and nowadays, like I said, immunotherapy also. So what happens is that, again, radiation therapy is not given in one go. So it's given in fractions, so that will run over to the tune of 5 or 6 weeks. That depends on the how much dose you have been planned as per your doctor's recommendation. There are certain side effects of radiation treatment, and good thing is that if you are getting radiation for a surface tumor or superficial tumor, most of the time your side effects are also localized to that area. But yes, if you are, say for example, if you are given radiation for head and neck cancer, so what happens is that you develop ulcers in your oral way, or the aero, or your digestive tract, like in your mouth, in your throat. So it's sometimes it becomes very difficult to swallow the food in a normal way. At the same time, we'll also have skin side effect. The skin discoloration is there, darkening is there, and sometimes ulceration is there. Although fatigue is not a very common kind of scenario as far as radiation therapy is concerned, because most of the time the effects are local only. But yes, since it's an ongoing treatment and you have already an incidence of cancer to the patient. So what happens is that their immunity is already low. For to overcome that scenario, what we recommend is that your diet should be very strong, with good protein and calorie diet. Also, you take plenty of fluids so that you are not dehydrated. At the same time, your doctor will also recommend certain multivitamins which are essential when the patient is getting radiation therapy, because to promote the healing, all these things are necessary. You have to maintain your nutrition, you have to maintain your fluid balance, and also you have to be regular as far as your hygiene is concerned.
Doctor, if you can also tell us about the surgery for head and neck and what kind of procedure is done.
As I told you earlier, also that surgery is the most common and the most effective, I mean, modality of treatment for cancer. That is applicable all the more to head and neck cancer, particularly oral cancer or the buccal cancer, which is the very, very prevalent and the common cancer in India because of the tobacco habits. Uh, in surgery, what we aim to remove the tumor completely along with the cuff or the part of the normal tissue, so that we ensure that nothing of the tumor or nothing of the cancer is left behind. But it's not just enough to remove the tumor, particularly in head and neck cancer, since it's a functional area. You have to swallow, you have to speak, as well as your tongue should be having the clearance function as well. Not only the functional part, but also it's a part of the cosmetic area also. It should not be disfiguring. So it's a multidimensional kind of approach when you apply surgery as your treatment. One is that you have to make the patient free of cancer, and second thing is that you have to preserve the function as much as possible, and then it should be aesthetically looking as well as far as cosmesis is concerned. So not only removal or the cutting out the tumor is an important issue, but at the same time you have to reconstruct it also. And there are a number of techniques with the help of plastic surgery. How do we reconstruct and establish the normal passes for the food as well as the function of the entire oral cavity? I'll just give example of tongue cancer. So again, just imagine what will happen when you remove the tongue and you don't reconstruct it. The patient cannot speak, patient cannot swallow, and then again the oral hygiene will become very poor. So what we do is that we reconstruct it either with the taking the tissue from the same patient's different part. Say, for example, we can reconstruct the tongue with the help of skin and subcutaneous tissue, which is taken from your wrist area, also from your leg area. So that becomes a functional tongue after reconstruction. So surgery remains a first and foremost treatment modality for head and neck cancer. Same applies for voice box or the laryngeal cancer also. Surgery again plays an important role and the most curative part.
Absolutely. And on that note, I'd like to thank you, Dr. Sunil Kumar, for joining us today and sparing your valuable time and educating us about different types of cancers. And with this, this is a wrap on this edition of Let's Talk Health. We'll be back with more interesting questions next week. Till then, take the jab if you haven't taken it, and stay safe, keep the mask up. On that note, namaskar. Many thanks for watching. Keep watching India Science.